We have and will continue to persevere.
We are all hoping to do our part to get us all through this.
It was solely because of the cooperation of everyone that we're able to sit here today to make those pronouncements. Our epidemiology, our public health nurses at the front line, our doctors and nurses who treat our isolated patients, this is all, I'm pretty sure that they are echoing the same thank you to our population for being on board with us to get to this point.
In December 2019, there was a cluster.
We have and will continue to persevere.
We are all hoping to do our part to get us all through this.
It was solely because of the cooperation of everyone that we're able to sit here today to make those pronouncements. Our epidemiology, our public health nurses at the front line, our doctors and nurses who treat our isolated patients, this is all, I'm pretty sure that they are echoing the same thank you to our population for being on board with us to get to this point.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations.
I say, nah, man. Wood. Yo, this is the Dan man Lindy telling you to be COVID-19 safe. Stay home. That way we could play a mass sooner rather than later. Everything will come to pass. You know the thing go. Mass must play. How you mean?
Good afternoon, everybody. Welcome to this press conference being facilitated by the Ministry of Health, another COVID-19 update, of course. And we have with us today the Minister for Health, the Honorable Nickolas Steele. He's to my immediate left. And then next to him, well, as close as possible to him, the Acting Chief Medical Officer, Dr. Francis Martin, and the COVID-19 Response Coordinator, Dr. George Mitchell. Of course, we're continuing to practice the social distancing protocol. We also have Mrs. Michelle Braffett from the School for the Deaf, and as I mentioned, we're here for another COVID-19 update. Without any further ado, I'll turn you over to the Honorable Minister for Health.
To you all. Today, Saturday, April 25th, I announce the laboratory confirmation of 3 additional positive cases of COVID-19 on mainland Grenada. To date, there has been a total of 18 positive cases, of which 17 are on island. 7 have now been medically cleared. 7 others are active, and now we have 3 new cases. So far, we have conducted a total of approximately 175 PCR tests and in excess of 1,000 rapid tests representing different sectors of the population. The first positive individual today is a female aged 50. She is an import-related case and is what is known as an asymptomatic carrier. She has displayed no symptoms to date. The other 2 individuals are males ages 62 and 59. Those 2 individuals were found through contact tracing in the workplace of the 15th case that we confirmed on Wednesday. The medical team continues to aggressively pursue any and all contacts of these individuals. In the last week, they have concentrated their efforts on several areas, including the residential community of the 15th case and his workplace, which has become a focal point of the investigation. I must emphasize here that the company in question was asked to close its doors earlier this week, and workers have been contacted and instructed to self-isolate. In the past few days, 69 workers have been tested through both rapid test and PCR to ascertain the spread of the disease. While health officials have made tremendous progress with contact tracing for our recent positive cases, they are still yet to determine the original point of infection of the 3 workplace-related cases. This means that there are yet a likely link of the workplace cases to an imported or import-related cases. This further suggests that the probability of community transmission of the disease. I cannot stress enough the importance in these times of staying vigilant and adhering strictly to the guidelines that we continue to plead with you to follow. These are not ordinary times, but unfortunately, many of us continue to act as if they are. There is no reason in this period why authorities should have to be called to break up social gatherings. There is no reason why people should congregate by rum shops during curfew hours or be out on the streets unnecessarily. These behaviors are highly selfish and they are putting all of us at risk. We are also noticing a trend through the contact tracing this week in which individuals are displaying symptoms but are not reporting it. You know who you are. Some of you might be sitting at home right now, or you might be out in your communities right now. and you know you have symptoms that are consistent with COVID-19, such as coughing, shortness of breath, fever, diarrhea, sore throat, and loss of your sense of smell and taste. This is rather irresponsible, and you are putting your families and communities at risk. You are endangering the lives of grandparents, siblings, parents, and colleagues. I know many of you continue to hold on to the belief that there is still no scientific data that states that the Caribbean sun will stop the spread of the disease. No, it won't. Rum won't stop it. Bush tea will not stop the spread. If you are exhibiting symptoms, or if you believe you have been exposed to the disease, you need to report it to the health officials immediately. Call, text, write, tell a friend, make the call. Do not leave your house. Stay at home. We cannot continue as we are. These careless behaviors must stop. We have been doing well, and we were on a decent trajectory to stomping out this disease on our shores. While we know that this virus is evolving, we anticipate that there will be pockets of it every now and then. For the foreseeable future, we cannot contend with a true community spread here in Grenada. The developed countries cannot handle it. So imagine what will happen here if suddenly all of our cases start exhibiting serious symptoms and begin to burden our healthcare system. Imagine the lives that will be in the balance then. Our medical team is doing its best, and I must commend them again. This includes St. George's University and our WinRef partnership response team that is conducting testing and assisting with contact tracing. The entire medical team is working around the clock, understanding the implications of not doing so. They are sacrificing their lives to save yours and mine. The least we can do in showing them gratitude is to not add to their daily anxieties or stress by engaging in behaviors that increase the spread of this deadly virus. They too have families to safeguard. I am begging you to please practice the measures designed to keep you safe. Wash your hands frequently. Do not touch your eyes, nose, and mouth with unclean hands. Exercise physical distancing. And please, please, please wear a mask or face covering over the nose and mouth when out in public. Remember, this virus is lurking right now in unsuspecting carriers who are not displaying any symptoms, but they may be spreading it as we speak. These are asymptomatic carriers, two of whom we previously found through contact tracing, and one we have announced today. To date, they still have no symptoms. This does not mean that they cannot transmit the disease to others. Be on your guard, people. This disease is not to be taken lightly. We have only to look to our brothers and sisters in New York and London, and we will understand the deadly nature of this disease. We cannot afford this here. So far, from official reports, we have lost approximately 75 to 80 Grenadians abroad in this battle, and the numbers continue to climb. Our hearts go out to them, and we urge those alive and healthy to continue to exercise due care and attention, just as we urge you to do here. We have heard traumatic stories from many who have been infected with this disease and managed to survive. Among those have been the young and the elderly, the athletic and the inactive. The disease is not differentiating between your strength or health and mine. It's coming after all of us, and we must be on our guard. In this period, now more than ever, we are called to a higher calling. We must continue to stand in the gap for each other. It is the only way to win this public health battle. I thank you, and may God bless us all.
Thank you, Honorable Minister. Dr. Martin, any words from you? And then we'll go to Dr. Mitchell if he has any words.
Thank you very much, Leslie, and thank you for the public and the listening audience out there. I do not have a lot more to add. I think the minister did a pretty decent pronouncement. I am looking forward to the many questions that persons may want to have answered.
Thank you. Dr. Mitchell?
Good afternoon to everyone out there. I concur that Minister said everything that in this case at this time needed to be said, and we await your questions to be able to fulfill them accordingly.
Okay, Mikey is online. Mikey, good afternoon.
Hi, good afternoon, everyone. My first question is, now that we understand that the risk of contracting the disease is higher now than it was, say, 3-4 weeks ago, yet what we have seen is some further easement of restrictions. Can anyone on the panel explain the rationale behind these decisions?
Well, I can start, and the doctors can continue. What we have found is that in the extended lockdown periods, not just here in Grenada, but in most of the Caribbean islands, have resulted in a process that technically is self-defeating. In that 4 or 5 days, we would spend inside under 24-hour curfew. And then on the 4th or the 5th day, when we are allowed to come out, we would all be lining up, all be congregating in mass. And as such, it's self-defeating. In continuing to have now regular opening hours for food and finance and other essential areas, the assumption is that individuals will leave their homes to access that only when necessary. But when they do have to leave their homes to access that, because it's open on a regular basis, Monday, Wednesday, and Friday for this week gone, that they would not have congestion or line up and having to interact with more and more individuals. So that is the rationale that we are using, and you will see many other Caribbean islands and other countries are using as well moving forward.
All right, I think I drew first this time. In addition to what Minister Steele just mentioned, we're not doing this thing by guess. This is entirely driven by complete and a lot of analysis going forward. So we are also driven by the data, by the science, by the amount of cases that we have had. And in the previous press conference, we mentioned that based on the number of cases that we had at that particular time, it was easier for us to analyze and say that, okay, we are able at this time to contemplate easing up a little bit, but we did say at the same time that it was premised on what we will find. And I was sure that the panel explained that very thoroughly, that it would be guided by what we find on the ground. So this has been our mantra. This is what we explained. This is what we have said. And as such, when we were at the stage where we had a number of cases, 14 cases, and that we had tested everyone, but we still, at the moment, at that time, said that we're not sure what was happening, and that we would be guided. Then we found this case, and as such, we want to be sure that whatever we do is guided by that, by the science, and at all times, this is what we're going to do. So any easing up of any time is going to be premised, as I mentioned before, on what we find on the ground. So I just wanted to reiterate that.
Let me add, the people that should be most fearful about easing is the epidemiology department, because we have a chance to see through, we have a chance to assess the risk and know what the possibilities are. We at the epidemiology department are quite sure that the structure that we have had and that the system we have been following so far for contact tracing has borne those fruit that we are seeing now today. We are not fearful. Our epidemiology department and public health professionals and community health nurses, we know our contacts. We know who they are. We know their families. We've started to contact almost all of them at the moment. And so we have a fair idea of what the work we need to do going forward in the next few weeks. And so the easing of some restrictions in no way is putting a danger to the current work that we have on the ground. Minister knows, and my former CMO knows, that if I ever get frightened about anything, I'll be first to tell him how I feel about it. So I trust the mechanism that we have so far. I look forward to the next few weeks of continuing that contact tracing that we know of, and we're going to bear fruit. I just want to say one thing though. The linchpin of all of this is for those of you who you know we have already contacted, those of you who we have spoken to, and we ask you to stay home. We honestly hope that you stay home, because that is where the biggest challenge is going to be for us. Our contact tracing team must know where you are to find you, follow you up, and test if necessary. We have already done the majority of it, but as a matter of fact, it's just continuing and stay steadfast to the process that we have so far.
Somebody else is asking if you can save the 50-year-old who has been described as import-related, got it from somebody in Grenada's system, and were the 3 persons who we spoke of today first tested with a rapid test.
The 50-year-old is definitely an import case. The history is very clear that that person flew into Grenada on a particular date. And after looking at the symptomatology, gladly and happily, the person was aware that they're coming from a high-risk area, and they self-quarantined. And that's why they didn't show up, because they stayed at home, because they suspect that they were coming from a high-risk area. So it's only after they finished the quarantine period and came out and got tested again, just for inquisitiveness, I just want to know, then it was shown up to be positive. And you know, that is how this virus is showing up. The other questions regarding the other 2 cases was?
Yeah, they were asking how were they first tested with a rapid?
Oh, yes. In these instances, they were first tested with the rapid test and then followed by the PCR. And part of that, again, is our own little internal validation to ensure that the rapid test is giving us the answers that we're actually looking for. I'm happy to say this time again, we were quite successful in the sense that the test showed us the results we intended to get.
We have another question from online here. How can social gatherings be controlled? Because I know the minister would have mentioned there's concern about people still gathering and not observing social distance protocols.
I think in the question you have given the answer. gathering and not maintaining physical distancing, not wearing a mask when in public spaces, interacting closely with people. That is how, and the only way that we can control any form of interaction publicly. If we continue to interact publicly and not maintain a social distancing, and while not doing that, also not wearing a mask, then we are asking for trouble.
Minister, you also spoke about people not reporting cases. How can we hold them accountable, those who suspect that they're showing symptoms, but they're not saying anything? What can we do to deal might not be the right word, but how can we deal with this situation?
Well, I'll leave that for the two doctors here, who the power resides with them, as the CMO and as the
You know what? My former CMO has more experience than me. So
No, it's a very, 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 very serious question, even though we are smiling. And I take it at two levels. If persons are not reporting, it is difficult to know whether or not they would have symptoms, because you don't know if they have symptoms. So we can only call on persons to please report. It is your more than civic duty to report. And that's why we have also made the call for our neighbors, for persons to be our neighbors' keepers. Not in a malicious way, though, that if someone make one cough, you go calling. No. But if, persons notice that someone is sick and maybe that person don't want to report, then we don't mind you calling and say, hey, look, I have noticed. So not in a malicious way at all. The other angle to that answer relates to if those persons actually report to a health provider and that health provider does not report. That is actually an offense. And I don't think that is happening now. I think our health providers are all on board. We have them with us in this battle. And don't forget that our first case actually was reported by one of our health practitioners. So we're all in this together. We have appealed to them to ensure that as much as possible, that the indice of suspicion, in other words, if they suspect any case at all, to report to us. So on that level, I am not too worried, but I am still going to appeal to every practitioner out there to suspect beyond the usual and to report to us. But in the case of individuals, if they don't report, then we really don't know, and I'm not sure what we could do about that. But let's community service and so sort of like be with us at this time so that we can report.
Thank you, Dr. Michelle. Raul Patterson, good afternoon. Are you there? All right, it seems as though he's not there. Johnson Richardson, we'll go with you. Okay, Raul, go right ahead. Johnson, just hold a second. Go ahead, Raul.
Yes, good afternoon. My first question is, having discovered 3 cases, I guess my question is a lot more relevant now. Minister Steele, could you tell us exactly what's the current status as it pertains to the ventilator and the Cuban doctor for Carriacou to incubate, God forbid, a patient if it doesn't have one, but of course if we get one, across Carriacou and Pitimate?
The protocol still remains in terms of an individual present in Carriacou needing medical attention, that they would be transported to Grenada. That is not right now, because it would be more than just one doctor and a ventilator. It would be doing a disservice to the people of Carriacou to simply say that if we have a doctor and a ventilator, let's send them up to Carriacou so that they can give a certain false peace of mind. The entire team is down here. And to leave someone in Carriacou that gets that bad with medical attention to one doctor would not be appropriate. It is to bring them as close as possible, so therefore bring them to the center that we have here, where the entire team is, not just the team ably led, the doctor ably our team of doctors, ably led by Dr. Noel, whom you met, I think, a couple of press briefs ago, but all of his people. So that is one of the determining factors as to why we still hold out and not just simply try to score what, in my opinion, would be a simple political point to say that we have a doctor and a ventilator up in Carriacou. It is more that we are able to deal with all of our people in the state of Grenada, and we have a mechanism in place. I'm not sure if any of the other doctors want to add to that.
For the people of Carriacou and Martinique, I am happy that what we have seen with admissions have happened thus far, because it gives us a first-hand experience as to what to expect for Grenadians who might fall sick with the COVID. We have noticed that for the person we have admitted to the ward so far, the single most important factor that determined admission was oxygen saturation. And low oxygen saturation does not automatically require mechanical ventilation. In other words, a simple pulse oximeter to test your oxygen saturation and the delivery of oxygen has so far shown to be the most important treatment for those persons. So for Carriacou and Martinique, I am happy to say to you that there is a pulse oximeter in Carriacou. Oxygen is available in Carriacou, and so far none of the patients we have had in isolation needed mechanical ventilation. So I feel confident that for our population, so far it seems as though we can get you stable enough for 24-48 hours to get you in time to transfer to the mainland if the need for ventilator arises. And so far, as I've said, we see no need for ventilators. And by the way, as I said in the last presentation, the science is showing that mechanical ventilation may not necessarily be the treatment for COVID respiratory failure. Let's not overshadow this. So we're still waiting on the science to prove whether this is the case. And so we may finally turn out eventually that mechanical ventilation is not an issue at all. So let's see where the science goes.
You have another question, Raul?
Yes, I have two more questions. In terms of the data, could you tell me how many people across Carriacou and Martinique have been tested thus far? Do we have that?
Yes, we have 57 persons in Carriacou and Martinique are tested to date, and probably maybe more than 57 by the end of the day today.
Let me just add, as per population, Carriacou is doing much better than mainland Grenada per parish.
For real.
So, yes.
My next question, does the virus mutate? And if so, what are some of the foreseen challenges for the health department should COVID-19, let's say, coincide with, let's say, the outbreak of ordinary flu season?
Viruses by nature mutate. The fact that the virus has jumped from animal to human was a mutation. The fact that the virus has found a way to go from human to human has to do with the ability of these viruses to mutate. As a matter of fact, there are a number of strains of COVID around the world right now. Some countries say there are 5 strains, some say there are 2 strains. We're still looking to see whether in the Caribbean we have a different strain. So the answer to your question is yes, that is the nature of this virus. God forbid, another virus or something else comes up that causes a problem. When viruses mutate, it creates problems not only for the person who is infected because of the complexity of the physiology, but it also poses problems for treatment. This is one reason why some viruses, we can't find a treatment for them yet, because they mutate and they change so rapidly. HIV is a very common one. So we really do hope that this virus stays put as much as possible. Influenza, fortunately for influenza, we've been able to find a vaccine for influenza. And even in influenza, there is influenza A, there's influenza B. HIV has HIV-1, HIV-2. HTLV has 1, it has 2. These viruses, they have personalities, and sometimes they get me upset and annoyed. But that's just the nature of how they are, and it just makes medicine a lot more interesting.
Raul, are you through?
Yes, no, my final question now.
All right.
We have, of course, 3 months to go before the Carriacou Regatta Festival. And what's happening to festival and events just about now, and rightly so too. Could you tell us, health experts, Dr. Martin and of course Dr. Mitchell, as to maybe when's the cutoff time for giving government or cabinet a timeline as to make a final decision as to pertains to the Carriacou Regatta? And would I be right in saying that the decision taken for Carriacou Regatta 2020 would also be the same for Spice Mass Festival 2020? In light of the fact that, of course, Regatta Carnival comes 1 week after Carriacou started.
Roll, very emotional question. Grenadians by nature like their culture, and I reckon that Carriacou Regatta is the same. Persons are also asking about Grenada Carnival, and the truth about the matter is that it is really difficult to give an answer right now. We must be realistic. We must take decisions based on what we know, based on the facts, based on what happens almost on a day-to-day basis. So if you ask me as coordinator, and of course the very strong links that I have on a daily basis with Dr. Martin and Dr. Sean in discussing the scientific issues surrounding the virus. If you ask me, what we're going to advise is that we're going to advise the cabinet to let's take it as it comes on a day-to-day basis based on the science and based what we see. In other words, we have to be real. It is important, of course, to make some forecasting, but those forecasting has to be based on what we find. So let's be quite real about it. I know persons are, wanting to plan, and who doesn't want to plan. I know of persons also not talking about football, about carnival and Carriacou Regatta and so forth alone, but persons are asking what happens to other competitions. And all of those are going to be based on what we find scientifically on the ground, and that is the reality of the situation.
I'm just going to say one thing. If Grenadians, Carriacouians, and Peter Martinique wants carnival, they go stay home. If they want carnival, they're going to wear a mask. If they want carnival, they will wash their hands and so on. And that's all I'm going to say about that.
Thank you. Johnson Richardson. Johnson, unmute your mic and go ahead. Callistra, we'll come to you in a second.
Yes, thank you very much and good afternoon to your panel. And I'm glad that part of my question was answered earlier. However, I think I must make the point that having looked at the plans and so on that was put in place, it is clear based on what the panel would have indicated earlier, that the present methodology that has been put in place to deal with COVID-19 relative to social distancing and the like is not really working. Yesterday we have seen the long lines and so on at the various service outlets and so on, Grenelec, Flow and so on. So basically the distancing that has been pushed by the Ministry of Health and the committee is not really working. That being the case, my question is, given what the science is really indicating now, there's a strong likelihood that COVID-19 would be with us for decades, over years to come. I just want to find out, though, as government commence that discussion relative to how Grenadians, how we envisage Grenadians living or coinciding with COVID-19 going forward. A discussion that speaks to making the necessary adjustment, realizing that COVID-19 would be with us as another of the medical issues that we have to face with as a nation, as the world. Have you commenced that discussion to date? If so, when would we see discussion in that regard? And are we prepared for the long haul, hoping that a solution or would be found anytime soon? If so, how are we moving forward in this regard?
If I can address that first, Johnson, it's you made a statement instead of asking a question originally, and therefore I have to correct it. I wouldn't say that what we are doing isn't working. I would say, as I've consistently said, and the doctors in the room have said, that there's still people who are not following what we are saying is necessary. And as long as that continues, I mean, somebody standing in line maintaining social distancing is part of what would be working. Somebody doing so without maintaining social distancing and not wearing a mask or so is somebody not being compliant. So there is a difference. But to your question, in my address, I did say that we can expect the possibility and the reoccurrence of cases showing up as we move forward. And therefore, we need to get accustomed to it, which is very different to being lackadaisical to it. So it will remain quite possibly among us as a society, and when I say as a society, as a world, as a region. We always have to be conscious of the fact that it can look silent and hidden in an asymptomatic person. You have, I'm sure, heard discussions with respect to vaccines, but that will take time. And also of other countries, like us, speaking of the eventual opening up, but opening up with the new norm of opening up while living with COVID-19 as a threat, in the same way that there are other diseases, contagious diseases, that exist among us, but the necessary precautions are taken. So that is what we have to prepare ourselves as a nation, not just a government, as a nation for. And the only way that we can do that is getting accustomed, for the time being, until there is a vaccine in wide circulation, getting accustomed to the social distancing and the various other protocols that we keep speaking about. But let me let the doctors say some more on that as well.
I'm going to continue on the onward going as it relates to how would a country deal with an infectious disease. There is an issue called herd immunity, and that's a term that is used to describe a country's, or the ability of people living in a country to resist a virus after becoming immune to that virus. And that immunity I'm talking about is your own immunity. So for example, if someone contracts COVID, their immune system builds antibodies against COVID. That is immunity. So if COVID comes back around a second time, hopefully your body going to resist COVID. So in other words, as COVID has come across the across to us, similar to the way chikungunya came across to us, dengue came across to us, Zika came across to us, you don't get chikungunya twice because you got it the first time and your body developed an immunity to it, and so the second time around you don't get it again. So, Johnson, going forward, I don't see COVID to becoming a serious issue for a government or a health system going forward. If a vaccine comes up, then it makes it easier for us. A lot of people don't have to develop that immunity again. But hopefully, during this era, enough Grenadians are going to develop immunity so as to avoid the virus from going from one place to one person to the next, and that's called herd immunity. Most developing countries, the health system functions in that way. In fact, this time around in COVID, I understand that there were some countries that was hoping to use that methodology of public health response, and it devastated their population. But that's another story. So there is a way going forward how we're going to deal with this from a health system standpoint.
Let me take the question in a slightly different way. We have said before that there has been no textbook in terms of how you respond to this virus. Absolutely no textbook. And we are learning as we do the response. We have developed strategies and we are employing strategies. We are listening to persons. We are being criticized. We take things on board and we are fine-tuning the response. And we, for example, notice that, okay, there are too many lines at the supermarkets, so we fine-tune our efforts to make sure that that does not happen. We did not anticipate that there were so many people sending money to Western Union and MoneyGram. And as such, the amount of persons created an issue. Yes, we are going to ensure that this is addressed. So, in other words, as we confront the issues, some of them we do anticipate, but some issues sort of like come upon the response, and we have to deal with them accordingly. This is not a textbook, this is not a Bible as to how exactly you should do this, and as such, we continuously learn and respond accordingly. So, it is really not foolproof. Nobody has gotten it 100% right. Countries are suffering, but we continue to listen and do our very best in our particular situation.
Thank you, gentlemen. Callistra, and then we'll go to Akisha.
Good afternoon. Well, the whole herd immunity situation came into the conversation, which was going to be the basis of my question. I wanted to ask whether or not, given that the World Health Organization has not given a ringing endorsement to rapid testing, they have raised concerns about this test validation and and so on, and the level of accuracy. Are we using this to determine whether, to what extent we've had an infiltration of the virus into our community? But the recent reports from the WHO is not really putting much confidence into that being such a big indicator of what countries are using that testing to look for. I don't know if we are using it for something else. And we now face community spread, the probability of community spread. We've seen increased a number of cases, as announced today, 3 more cases, but yet we're opening up. And I understand the economic challenges that the government faces, and that the opening up probably has a lot to do with the fact that the government is in a financial crisis. But are we hoping that herd immunity is this? I mean, you talked about it, and I know Dr. Martin's talked about other countries doing it and that it didn't work well for them. But is that part of our strategy? Because we seem to be opening up while our outlook gets worse. Community spread, tests that are not 100% foolproof, and in cases. My first question.
The issue of herd immunity is not a strategy of the Ministry of Health. However, herd immunity is a natural phenomenon that happens when a new virus hits a country. So whether we've taken it on board as a strategy or not is immaterial, really, because at the end of this era, enough Grenadians will be infected with the virus and develop an immune system for it, further decreasing the chances of it happening and going forward. We are more interested in being proactive, testing, track, and treat. And if a vaccine comes about, we're more than happy to get it, because a vaccine would fast forward the immunity of your community. But even if a vaccine is not there, then herd immunity is going to happen naturally, because we do have infections on the ground. We expect to see more, and as a result of that, I expect some level of herd immunity to take place.
I also thought that I addressed the issue of opening up when I answered just now, to speak to the fact that whatever happened and whatever would continue to happen would be based on what we find on the ground. And that is, at this time, what our strategy continues to be.
Let me also address the issue with respect to the rapid test that you had inferred in your question, or before you asked your question. We have consistently said that a rapid test is another form of screening for us. We are not using it as anything definitive. It is another form of screening. Before the existence of and the presence of rapid tests here in Grenada, the only forms of screening that we would have is questions and checking individuals' temperature and asking them for symptoms. Now we have an additional form of screening, and I cannot mention enough the word screening, and that is what we use it for. It has assisted us significantly in our ability to do contact tracing and in our ability to determine more accurately who should be tested with PCR. And the World Health Organization is made up of its members. The World Health Organization has not endorsed some forms of rapid test or so, simply because it's waiting for its members to qualify the specificity, the accuracy of those very tests. That is the process in the World Health Organization for adopting any policy. They have asked us, as they have asked other countries, to sign on to certain other protocols or testing. And that is how, as a global community, we will be able to determine through that central body called the World Health Organization as to what are some of the best treatments and tests as we move forward.
Okay, Kalisha, are you through? You have another?
I have another 2 questions, please. I understand that you're seeing an increased number of people arriving at our emergency room with flu-like symptoms who are not being tested. This is what I understand. Could the doctors comment on this? Are we seeing an increased number of cases? And is there any truth to the fact that they're not being tested?
Kalisha, can you just repeat that for us, please? We didn't hear you too clearly.
Oh, sorry. I understand that there is an increased number of cases arriving at the emergency room. Are you hearing me better now, Les?
Yes, go right ahead.
And that they're not being tested. Now, Dr. Dolan Noel recently said that there's a screening process for everyone who comes through the emergency room with particular symptoms. But I'm being told that that isn't happening. So my question is 2 parts. Are we seeing an increased number of people presenting coming to the emergency room with flu-like symptoms? And is there any truth to that rumor that they're not being tested?
Compared to this time, 2019, there is a decrease in the amount of people showing up at the ER with flu-like symptoms. And I guess that's because of restrictions and travels and what have you. So there is a decreased number of persons showing up with flu-like symptoms. Our directive is clear. The medical director is certain about what we've asked of them. The process is that anyone shows up with flu symptoms, they should be screened for COVID. It is as simple as that. However, at the point of contact, the doctor who is seeing that patient takes a history, does a physical examination, and makes a determination as to what should happen to that patient. I trust the doctor's judgment. I trust what they do. If there are any specific patients who have felt that they didn't receive the care that they wanted or hoped to receive, you're more than likely to speak with the medical director. You're more than likely to call me. I can review your case and determine whether there is merit to it. But we're very clear that given the COVID situation, someone with flu symptoms should be screened. The doctor will make a determination as to whether the screen would be a rapid test or a PCR or both.
Quite frankly, Kalisha, it's Kalisha, right? Yeah, quite frankly, Kalisha, I want to be able to put my neck on the block, and I am going to put my neck on the block for that one. I cannot see that happening in our present climate at all. Our doctors and nurses at the ER are forever and has been forever on this, and the merit of this story, I do seriously question it. I think the guys are doing an admirable job out there.
You have a final one, Kalisha, and then we'll move on to Akisha.
One more less, thank you. It's not a story, Dr. Mitchell. It is information that came to me, and I'm seeking verification from the people who are supposed to know about it. So it is not a story. It's not one yet, although your answer may end up being a story. My final question, Minister, I was someone who, this is not my question, but someone whom I hold in very high esteem, wanted to, also in the profession, wanted to ask for you to clarify what you meant when you said that herbal medicine is not going to be a protection for us or something to that effect in the fight against COVID. I believe you were casting doubt on the efficacy of herbal medicine as a protection.
If that person listened to the entire address, they would have heard that I said rum as well and the sun. And they can clearly infer from that unless it is accepted, and you yourself brought into question whether the WHO accepts certain tests or not. We can use your same logic to say that unless the WHO has said, then we should not be relying on it, that it makes us invincible or that it is a cure. And that is clearly what I was saying, and that is the only thing that can be inferred from it. Unless we are able to scientifically verify something, then no member of our population should take for granted that it is going to make them more invincible, or invincible as a whole, or that it is a valid form of treatment. We need to rely on the science and the medical practitioners who to date have been especially here in Grenada, the team that we have been guiding us appropriately with respect to treating those who have been infected.
Great. Keisha, go ahead.
Thank you. Good afternoon to everybody. I have two questions. One were answered in part. I don't know if I can ask it again so you can get more information. With the confirmation of 3 cases today, would we see a revision by the authorities with some of the incidents in place? That's the first question. The second question, how many health officials to date have been tested?
I'm assuming your first question, I didn't hear it too clearly, but your first question is whether we'd see a revision on the policies based on the fact that we picked up 3 additional cases, or we're announcing 3 additional cases today?
That's correct.
Doctors?
I would not be able to give you an exact number of health professionals that have been tested. I can confirm that health professionals are being tested as we speak, but I cannot give you the number simply because some health professionals who have dedicated their lives to this, they've said that they want to just finish their stint at the department before they get tested. And my heart goes out for those doctors and nurses who've decided that they're going to do this. And so that has been the decision that they've made. But enough tests are available to ensure that everyone gets tested. Our medical director has in her storeroom a set of tests specifically put aside for our healthcare providers because we want to make sure that they have the amount of the resources that they need to test them when they do. I have had the result of some of the healthcare providers who have been tested. Gladly, God bless, they're all tested negative thus far. So testing is ongoing for our healthcare providers.
And just to be direct with respect to the policy, no, there isn't any desire or suggestion by the medical team as well to reverse on. There is reinforcement of their plea to adhere to the policies that they've been asking us all as a nation to adhere to.
I have just been informed that all my community health nurses who have been working like, oh, these nurses are really something, they all have been tested and they all are negative.
Akisha, do you have another?
No, that's it.
Okay, great. Let me just take a few from online. Somebody's asking the connection between the task force and the COVID committee, just to ensure that everybody's on the same page, everybody's in sync.
I'm a little confused as to the separation that they're making.
All right, so I'll see clarification. Is
Yes.
the COVID-19 team, somebody else is asking, is the COVID-19 team considering quarantine under government control as is being done in Trinidad?
We do have quarantine under government control, as is considered, as is being done in Trinidad for anyone who has come in to Grenada since we closed our borders and so. That is what Trinidad did too, where they had certain citizens that were isolated in Barbados, I think, and also on a cruise ship or on a vessel. And they took them and they put them into a quarantined environment in mass. We do have those contingencies in place, and that is what we have been practicing and would continue to practice. For instance, with the request that we've had that we are finalizing for the Grenadian citizens who are technically stranded on cruise ships. So we are in discussions, and that would also most definitely involve them being quarantined in a government-maintained or government-approved facility.
In addition, we have facilities to quarantine nationals who are here that we need to separate for one reason or the other. Let's say they're discordant persons in the home, and discordance mean there is one person who is positive and another one who is negative, and we need to separate those. We have facilities that we are currently using. As a matter of fact, we had those facilities since the beginning of our COVID response ages ago. As we speak, one such person is now being taken to one of our quarantine areas, and that one is well controlled with security and everything like that. So we are ready for that kind of eventuality in the event that it needed, especially now that we have to widen our net when it comes to our contact tracing.
Leslie, can I just add that for the callers' information, we do have a really nice comprehensive strategy plan that we continue to fine-tune as the time evolves, relating to who, how, when we quarantine persons. And it is really a work of art, so to speak, because we have a lot of persons out there who would like to come back as we speak. Persons who have been trapped out there because they went on vacation, on business, some who have had plans to come, who have bought tickets, business people who are out there who would like to come back. We have Grenadians who would like to come back at this time, persons' visas who have expired. So we have a lot of persons out there who would like to come back, and then we have locals who, for one reason or the other, as Dr. Martin has been explaining, would necessitate quarantine. So it's a comprehensive plan that we keep and continue to fine-tune in order to appropriately deal with this particular issue of quarantining in the safest, as I say, possible way. And I must add, in the safest possible way, to ensure and to give our people the assurance that those persons are not allowed to come back home to contaminate our population further. So that is basically what I wanted to add to this.
Thank you. Mikey, you have another question?
Yes, I have several questions, if you may permit me. Now, the first one is that I know that we heard from the Pan American Health Organization regarding the region having its worst time yet to come, and we to some degree challenged that pronouncement. But could that have had anything to do with complacency? Because her statements are to some degree proving to be true. Now, how do we continue on the process of easement while at the same time not sending the message to our citizens that we are more comfortable with where we are? Because that can result in complacency. So do we have a strategy other than saying to people when we have these press conferences that, hey, this is dangerous, we need to practice social distancing, XYZ?
Yep. Mikey, let me address that. And it is the Pan American Health Organization, not the OECS. It's a Pan American Health Organization. Dr. Carissa Etienne is a dear friend, and we speak consistently. These doctors here have been speaking consistently as well with the Pan American Health Organization. And specifically what she was talking about is the region, America, Pan America, from Canada all the way down to Chile, including the Caribbean, Latin America. And she was talking, she mentioned Latin America and the Caribbean as well. Now we are seeing other Caribbean countries that are yet to have any slowing or cessation of new cases, and also of cases that need hospitalization. And those are the countries that she's referring to as well. And that's in the Caribbean as well as in Latin America, South America. It doesn't mean, as we have consistently said, that we are out of the woods. We have consistently said and adhere to what she is saying. The easing of, or what you are referring to, or other people are referring to, the easing of is more of an adjusting to the new norm while still maintaining a definite level of caution. It's not a opening up and a free-for-all as we might be seeing in other jurisdictions. Jurisdictions outside of the Caribbean. But it is an adjustment of what is the new norms we are ever conscious of, and that's why we continue to test and screen, and continue to look, and continue to preach, literally, to preach to the public to still maintain their level of discipline with respect to social distancing, wearing of masks, and why we still haven't allowed any and every business to open up, but we have been specific to what is maintaining as best as possible tolerable life, not normalcy, tolerable life, food, finance, and the few parts of manufacturing or agriculture that we have dealt with, because we do need to begin producing food in particular for ourselves, while the rest of the world is also on some kind of relative lockdown. So you will see logical, coordinated with Pan American Health Organization as well, any adjustments that you are referring to as easements. But these are adjustments in coordination with Pan American Health Organization.
Minister, may I add, and just for my keys, ease of mind, that the objective of this whole exercise, the primary objective continues to be ensuring that we save and take care of lives in this country. And I just want to reiterate that. So every decision is actually premised on that overarching responsibility of the country, of the committee, and of our medical team that actually guides us. So I want to reiterate that, and I want the public to know that the decisions that are being made on every occasion is premised on ensuring that as much, in other words, the overarching responsibility is to save lives. And I'm really, really happy to know that we have saved lives, that no one has died thus far, knock on wood, as we say. But I just wanted to put that out there, that with every single decision that is made, at the back of our minds is to ensure that persons' lives are considered and valued as the most important factor in our decisions.
All right, thank you for that response. And the next question is, the credibility of the testing in Grenada, it was put in some degree into question pending the results of case number 15. Was there a time when the medical experts were doubtful about the credibility of the test or testing kits being used relative to case 15?
First, and the doctors will agree or disagree. They're free to. We never questioned the credibility. We were very specific in that because of the possibility of this being a community spread, when we first got the information and we were doing tracing, that we wanted to be sure because it would change our status. So we asked CARFA as well to do a test, and we also did other tests. Now the screening, remember the rapid test is screening, and there were two different results on that screening in the same way, if I would assume if temperatures were taken and there were two different temperature readings in a screening process. And there is a scientific explanation that they can give as to why the first time the PCR gave one result and the second time it gave a different result. So I'll let them address that.
The turn of events with this particular case, it's not unusual in medicine. That is something that happens in medicine, where if a doctor has a very high index of suspicion, despite what the results say, the doctor will retest And in so retesting, the doctor will indicate to the lab that, we need to keep searching deeper. We need to look to see if there's other ways we can test to see the possibility of a test. The other thing is, as the body's physiology changes during a disease process, you may find that the body responds one way now, and then a day later or a couple hours later, the body responds differently. So that is not unusual. This particular case was probably the most important case that we've had since the beginning of COVID, because we knew what the implication was and what the things that can be followed out of this. So it was very important that we become extremely sure of what we were dealing with so that we can mount an appropriate response. And I'm glad it turned out the way we did, because within medicine we follow the rules that guides how you treat with a patient of that nature. We follow those medical guidelines, and at the end we got the result we intended, we needed to get, and so the appropriate reaction was taken.
Martin, let me just add that it speaks to the thoroughness, how thorough we are and how complete we are in ensuring that what we see is what we get.
All right. And my final question?
Okay, go ahead.
Okay. Is the ministry collaborating with pharmacies to help identify persons who are seeking over-the-counter medications for what they may think is a cold or asthma, and may very well be the COVID-19? Because I'm not sure if when you do your tracing, you realize that a lot of people who come up with some of these symptoms have, at some point in time, visited a pharmacy to treat some of their symptoms.
That's correct. In fact, during our contact tracing and our investigation, that said issue came up. We were able to identify those pharmacies. We were able to identify using our CCTV and other forms of investigation to find out. So yes, there is that level of collaboration. But I understand where you're coming from, because there are a lot of persons who have flu symptoms who may not want to get tested, as was indicated earlier during this press conference, and they may choose or may elect to go to a pharmacy to ask for cold medicines. Again, we all being each other's keeper. We are encouraging our pharmacy partners to gently persuade those persons to get tested. We're happy to be called from any of our colleagues, pharmacists, to assist in this process.
Johnson, go ahead.
Yes, good afternoon again. And just to follow up my first question, I'm not sure if I didn't get what I was looking for as an answer in my first question. So I'd just like to add to ask again, in the face of the potential serious economic threat that Grenada is under, how far are we prepared to go with a lockdown? All right? And I was asking also, have we started a discussion that would prepare the Grenadian community, the Grenadian public, to use this time to better prepare themselves for the challenges ahead? That was the line of my questioning. So are we, in the face of what we're facing now, how are we preparing the Grenadian people to deal with the situation going forward? All right? And I'm talking here about the likelihood of the serious economic challenge that the country is up against. My second question, though, is, apart from the COVID-19, are we also treating the H1N1, which is also similar and has been around for some time? Are we also treating, apart from COVID-19, are we seeing cases of, are we testing for cases of H1N1 disease? And my third question, though, is relative to case number 15. Case number 15, can we provide the Grenadian public with the travel dates for that individual? I heard earlier that we can confirm that the person is an imported case. Can you provide us with the information when that person did actually arrive in Grenada?
Let me address your first, well, I'm assuming it was a question and not a statement again, about the economy and preparing the Grenadian public. Look, our Prime Minister said from day one that this is about lives and not about money, and that principle still maintains. however long it takes to make sure that the lives of our people are not placed unduly at risk is how long we will have to get this done. We are not alone in this. Oil has collapsed to under $1. Economies across the world are being challenged, and that's an understatement to say that they're being challenged. It's worse than that. But most proactive governments and leadership have placed the lives of their individuals first. We have done so and will continue to do so. In terms of the preparing of the public, quite a lot of time and effort has been spent to announce the various measures that the government, financial measures that the government is putting in place to look after those who may be or continue to be disenfranchised as a result of the measures we're taking to protect life. So that, I think, can categorically be said as proof of preparing, and as well as the amount of time that was spent talking about stimulus packages as well to reignite the economy once we get past this part of this COVID experience or this COVID-19 journey. So, and there continues to be additional input and discussion on how we will move forward, as well as you've heard the doctors and myself saying about, and others are in the world talking about vaccinations, and even Dr. Martin implied about herd protection as if this were to move forward and drag on for months, and we would keep seeing one or two cases or so. We have sought to make sure that the curve is flattened as much as possible, in that we don't overburden our healthcare system while we, like every other country in the world, live through the threats of COVID-19. On the other parts of your questions, I'll leave it to the medical doctors to address.
Minister Steele, I'm sure that there has been conversation, and I'm hoping that I heard the Prime Minister right when he said that there has been a multipartite team, and you probably want to sort of like elaborate on that a little bit. There has been a multipartite team that has been asked to look at that kind of a question that the journalist is actually asking now.
We address up to this week, the Prime Minister announced the formation of an additional grouping, and that would follow the various sectors as well. So subgroups of persons that would be focusing purely on the reigniting, re-stimulating of the various sectors of our economy, and that in each of those groupings, health would play an active role in that, and that it would rely on the expertise and experience of individuals from those various sectors. So this is the focus, while this team here focuses on minimizing our risk exposure. There are other teams, and I participate in some of those, with respect to the way forward as we move on. And both have to be done at the same time, and both are being done at the same time. And I know the others are spending a lot more time on that future, however quickly that can come by the grace of God, spending a lot of time on that, not just individuals here in Grenada, but individuals outside and entities outside. There's been significant discussion with World Bank, with IMF, with UN, with Pan American Health and WHO, with CDB, with ECCB, on moving forward, as well as the heads of OECS and the heads of Carriacou on this. So this is very much an ongoing discussion that a lot of time and resources are being dedicated to. So because there aren't regular updates does not mean that there isn't quite a lot happening behind the scenes. We have been charged to come to you to give you transparent updates on infection. and COVID-19 from a public health standpoint. But very quickly you will see more and more happening with respect to updates on the financial and the economic packages and the economic stimulus and the way that we will reopen, not might, will reopen our economy once or first off in the phased approach like everyone else that is following this logically, a phased approach internally, and then the looking to where it is safe to do so, an approach within the region or extra-regional where it is safe to do so, following on the original principle of lives first before money.
I wanted to just clarify something I said earlier. It's causing a little discomfort with some persons earlier. We were talking about the issue of vaccination and can you get this over again? And I spoke as a matter of virology and the study of viruses, that the possibility of not getting an infection again, you could become immune to a disease by forming antibodies, and the issue of herd immunity. By no means was I saying that herd immunity is possible with corona, and that once you get corona, you will never get it again. By no means was I saying this. I was just speaking as a matter of public health response and general how these things happen. At the moment, there is no conclusive evidence that there is herd immunity, and there is no conclusive evidence that if you get this virus, you will never get it again. But it is a discussion going forward, and science is still studying this phenomena, and we just have to wait to see what the answers are going to be.
Thank you. All right, so it's time to put a wrap on things. Thank you, gentlemen. So we'll start with the Honorable Minister. Any parting words that you have? Then we'll go to Dr. Martin and Dr. Mitchell.
Let's do it the other way around.
Okay, great.
Yes, I want to thank everyone who has tuned in, all our listeners, local and abroad. We want to thank you for your support. We want to thank you for your suggestions. We want to ensure that the message that we have been asking you to listen to, that you listen to it properly. To say it quite simple, that we are asking you to save your life and save that of your loved ones. We are asking you to respect the issue of social distancing. We want you to wear your, I don't want to say face mask, your facial covering appropriately, especially when you are in places, in public places, or in buildings. That would protect you and protect your families and your loved ones. I would not get off this press conference also without, as I usually do, thank our frontline workers. The COP commissioner is not there, so I would make a pitch for the IGPF members. I would make a pitch for our healthcare providers on the front line, and I would make a pitch for every single worker, customs, everyone, NAWASA, who have been out there serving our population during this time, and say how grateful Grenada is as a result of your effort. And I want you to continue to be safe, continue to exercise good judgment, and when this is all over, we will enjoy our beautiful island of Grenada. Thank you.
Oh, sorry. I'd like to first of all thank the public for the tremendous show of solidarity and support last night. at 7 o'clock. In fact, one girl played a violin piece that I shared with some of my colleagues. She's now a grade 5 violin. Thank you very much for that wonderful piece. Also remind the public that there is this 4-3 virus 24-hour call that you can use to access information that you want to get access. And lastly, to say that CMO, I believe that our strategy, our 5 lines of strategy is continuing to work. We're continuing to see that issue working. Our public education has not stopped. We need to do more of that. I think we also need to now step up our education to help people cope with being inside. And I'm speaking specifically here of chronic disease patients and those who have to struggle with their chronic diseases, either medicine availability or the types of foods available to them at home. I still think is an opportunity to eat better because you're at home and you're forced to eat from the land. So I think this is, I want to continue to encourage you to do this. Our strategy of monitoring has gone on, or the strategy of controlling our ports of entry is still there, and I want us to keep doing that. Partnership is also a strategy. SGU has been a great partner to us, and also looking at our vulnerable groups and testing. We have improved our testing quite well. So I am confident that the strategic lines that we have is continuing to be robust in terms of our response, and I have no doubt that the team, especially our team out there in the community, doing our contact tracing, must be really, really supported. I visited the isolation unit the other day just to chat with the doctors and nurses at the front line, and also visited them where they were, where they're staying. And I was saying to them, you guys have a lot of love out there. People are really showing a lot of love for you. And they were telling me that they believe the community nurses are the one that really needs to be, supported, because their community nurses are doing a lot more work than our isolation doctors are doing. But that being said, we're up to the task, and I really feel confident that the team is behind us. And I really thank you all very much for that.
Thank you, Minister.
Well, if I can start with just for clarity, it is an offense, according to the Public Health Act now, not to report. If you or someone in your household or someone in your neighborhood has symptoms and you are aware of that, that is an offense. But moving on from that, just simply to use this opportunity to say thanks. To say thanks, Dr. Martin has already expressed their appreciation, a tremendous appreciation from the frontline workers for the show last night. But I want to take this opportunity to thank those who helped to organize that event, that really heartfelt and patriotic show of support to all of our frontline workers, to also take this opportunity to thank some of them. I always try to call out one or two of them in closing. Today I want to call out our stevedores and frontline workers at our ports who have kept those ports working, who have been at risk interacting with, but have recognized the role and the responsibility they have, and continue to show up, our customs, our immigration as well. Also, our postal corporation that opened up this week, and I just got information while we've been here on air, so I want to take this opportunity to recognize the level of dedication that they have, that they were there today sorting mail to make sure that certain emergency medical mail that has been sitting maybe for a week or more, weeks, was sorted and delivered to the individuals who needed to get it today and couldn't wait until Monday. So to the Postal Corporation individuals as well as customs that would have had to have gone there and airport to assist with that, for your dedicated work to Frontline. And also to recognize the role that our Trade Union Congress has been playing and the members of the Trade Union Congress. They have been playing a significant role in terms of being part of this, and to acknowledge the fact that they know and we know that they have an even more active role to play as we move forward in terms of reopening and getting things moving and helping us with their interaction with their members and reporting to us where there are issues that we should be aware of or that we can collectively work to address. Again, continued sympathies to those among us who continue to lose relatives, and to recognize that those who are in quarantine, that they need to have the support, if at least the moral support and prayers from us, but they also need to have the discipline to stay in quarantine, stay in shelter, communicate to us so that we can assist them in any way possible to help facilitate that. And as we move forward to those who are continuing to ignore the pleas, the advice, the regulations, there are many of us out there who have no problem with being our brother's keepers, have begun to exercise their right as citizens to report where they see offenses, and that I see as the growing trend and the only way that we will be able to stem or prevent those who continue to ignore and force them to adhere. So I want to thank those citizens who have reported offenses, and to continue to plead with those who are not following to please follow the advice of the Ministry of Health at social or public distance, physical distancing, cough etiquette, washing your hands, and most definitely wearing your mask when you're in public and not in social distance. If we all do this, we will get through. We are almost there. I know, like us, you see this as a setback as well as a nation, and it is. But it does not mean that we can still see, as we were seeing last week, the light at the end of the tunnel. It does not mean that we are not still on a trajectory. It just simply means that because this is not a straight line thing, it means that it will have its ups and downs. But as long as we constantly unite and work together to fight this, we will win this battle. So thank you, and God bless us all.
Thank you, Honourable Minister. So we had here with us today the Honourable Minister for Health, Nickolas Steele, the Acting Chief Medical Officer, Dr. Francis Martin, as well as the COVID-19 Response Coordinator, Dr. George Mitchell, and of course, Mrs. Michelle Braffett from the School for the Deaf. Now, we cannot emphasize the fact enough that it is an offence to have flu-like symptoms and not report it. And if you know, you suspect somebody has flu-like symptoms as well, it is your moral responsibility to report it as well, as we try to protect each other. Thank you so much for being with us today. I'm Leslie Ann Johnson. Have a great evening.
I say, nah, man. Wood. Yo, this is the Dan man, Lindy, telling you to be COVID-19 safe. Stay home. That way we could play a mass sooner rather than later. Everything will come to pass. You know the thing go. Mass must play. How you mean?
Boom shakalaka, this is Ledneck from the West Point family, reminding all Grenadians to be COVID-19 smart. Stay home, it's just for a short time. We will be back on our feet soon, alright? Bless.
5 things you need to know about self-isolation. Stay home. If you are told to self-isolate, it means staying at home, not going to work, school, or other public places, and you should not have any visitors. Separate yourself. If you live with others, then you need to stay in a well-ventilated bedroom with the door shut. If you have to share a bathroom, then use it after everyone else. Don't share towels and toiletries, as this may put others at risk. Call ahead. If you develop symptoms such as a fever or cough, then seek advice first by calling the Ministry of Health's hotline at 538-4787 or 458-4787. please do not show up at a medical center or hospital, as this may put others at risk. Take care with waste. If you test positive, your waste should be double bagged and disposed of separately. Create a buddy system. If you live on your own, you can plan with friends and family to check in with each other and run essential errands if one becomes sick. Once sick, they should leave groceries on the doorstep. Why it's important. COVID-19 causes a mild illness for 4 out of 5 persons. Self-isolating will help protect the older generation and those who may have underlying health problems from getting infected.
Stay up to date with all that's happening with the new national party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.